Hello everyone, welcome to Xinflix. Today we are very pleased to welcome MP Taylor Roy. Hi Leah, how are you?
I'm well, thanks. How are you doing?
Very well, thank you. Especially talk
Good.
with you. We are talk about the health problem, so that's lots of questions from me, from all the audience. So Leah, the very first question we want to know, what actions does the federal government takes to support our healthcare services?
Yeah, it's really, healthcare is such an important area, and it's the federal government working with the provincial government to provide those healthcare services. And we know that there's been a lot of challenges recently in the healthcare system that we've seen exacerbated by COVID-19. And so our Prime Minister met with the premiers across Canada to talk about what was needed, and came up on February 7th, just recently, with an historic investment of $198.6 billion to be transferred from Ottawa to the provinces over the next 10 years. And that includes over $46 billion of new funding. And so the Canada Health Act obviously is for all of Canada, but provinces are responsible for the delivery of health care. The federal government funds them, and so we're putting all of this new money into the system, but we know that we can't just keep doing the same thing we've been doing. We need to get better results for everyone. We need to get better results in Ontario. And so in addition to the normal kind of transfers that have been made, there are these new transfers, and the federal government is sitting down with the government of Ontario and negotiating what are the outcomes that we need, what do Canadians need, and what do we want to make sure that the province delivers to Canadians. And so there was an agreement reached in principle between the federal government and the government of Ontario on February 23rd, where they've agreed on what we're going to be focusing on. And so there's basically 4 main priorities. One is access to high quality family health care. So that means the family doctors we all want. And we know there have been a shortage of them, especially in remote areas and underserved areas. So one of the focuses is going to be being sure that every family has a family doctor or a healthcare team that can take care of them and help them navigate the system. The second is we have to strengthen our workforce in healthcare. We need more healthcare professionals, as we all know. And part of that is making sure that people who are in Canada that are trained as healthcare professionals can practice in Canada. And so our provinces control that. We need to make sure that there is a process where it's not taking 10 or 15 years for someone to start to practice. We want to make sure that people who practice in Canada are well trained, they understand our system, and that we want to take care of Canadians. But there are so many people out there who come from all over, because Canada is a land of, immigrants, of settlers. So we want to make sure that they can work, and that's one of the things we're talking to provinces about. How do we get them to be able to practice more quickly? And also, how do we get more Canadians? A lot of our children want to become nurses, doctors, physicians, assistants. We need more schools for them. Right. We need more training. We need more opportunities here in Canada for them to train here and stay here. So that's very important as well. Another thing we were talking about earlier was mental health. And, Carolyn Bennett is our Minister of Mental Health and Deputy Minister of Health. And as she says, mental health is health. It's part of our overall health, and there's really no distinction. So we need to be sure that we are funding and the provinces are funding mental health services through the Canada Health Act as well. And then lastly, and it seems like a very bureaucratic thing, but our information, our healthcare information. When someone ends up going to the emergency room, if a doctor or a nurse there or another healthcare professional can't see your records, quickly and easily, your health care is at risk. We have to make sure that we have records for everybody that can be shared, highly confidential, just used by the healthcare sector, not used by the government, used by the healthcare sector, but to ensure that we're taking advantage of technology and making sure that when someone comes, a doctor knows, are they allergic to something? Have they already been in a hospital for something 2 weeks ago? You know, what has their family doctor said? Because it makes it so much easier and it makes the care so much better. So we have to make sure we have data. And I think that's one of the other areas that we've agreed on with provinces, with the province of Ontario.
Lots of things to do, right?
Absolutely.
It takes time too. So just right now, Leah, you talk about provider, the health system provider. So right now, as we know, there's a shortage of the provider. It may take 5 years or 10 years. So there's a lot more school going to build up in Ontario or in the federal, all countries.
Yeah, it does take a while, but I do think we have, as I was saying, we have people in Canada who are already trained, like they are healthcare professionals. We have to get them into the system faster, while making sure that they know our system and they can work and work with Canadians and residents of Canada to keep people safe. So there's always that balance between, we want to make sure they can get there quickly, but we also want to make sure that they're providing quality health care and know our system. But I think it could be done more quickly than we're doing it now.
Right.
And I think that's one of the things we're working on. So I think that will help. The other thing is, we have personal support workers. We have nurse practitioners. We have a lot of healthcare professionals that can play a bigger role in our healthcare system. We've seen pharmacists recently being able to prescribe very, they're very well trained, our pharmacists.
Right.
And for basic, medications that you come in with a cold, they can prescribe those, and now they're able to. And that will take some of the pressure off of the doctors to always have to see people for things like a flu or a cold or strep throat. So we can be smarter about the way we deliver healthcare too. Yeah. And I think that's what we have to do, because our population is aging, our population is growing, there are more healthcare pressures, and we have to be cognizant of how much it's costing our taxpayers too. Right. So we want to be smart. We just don't want to put more money in it. We want to make it work better. Yeah. And that's why we're having these conversations with the provinces.
Yeah, work better for the whole system, for health system. So talk about the population. As the immigrants of Canada, they talk about the immigrants from overseas. Will we take the overseas doctors or the nursing or the health providers?
Yes. Yeah. Yes, we already do, but we do it too slowly, and we make it too difficult. Mm-hmm. I think that, if we have someone who's been trained in medicine, a human body is the same here as it is in China or India or England or anywhere else. But what we need to be sure is that when these foreign trained professionals come to Canada, that they have some Canadian experience and that they understand our healthcare system. So that's what I think we need to focus on, and to be sure that the training they've received is comparable to the training here. But in most cases it is, and I think the provinces need to work with the colleges of physicians and surgeons, the colleges of nurses, and work with these bodies to try and expedite, while being safe, as I always say. We have to make sure they qualified, but I think it's taking too long, and I've heard so many stories of people taking 10 years. Right. And it doesn't make sense. It shouldn't take 10 years. Maybe 1 year, maybe 2 years even, but not 10 years. That's something's wrong with the system if it takes that long.
Right, and also we're in a quick needs, especially. So especially this pandemic, during this pandemic and after the pandemic. And also I heard lots of story. They talk about emergency waiting time. So all those problems solved. So the emergency gonna be very fast, and as soon as possible you can solve the problem.
Yeah, and I think part of the problem in the emergency rooms is the backup is there because often there's not beds available. Yeah. And people are coming to the emergency room sometimes because they don't have a family doctor. Right. So it's not an efficient way to run our healthcare system. So more personal support workers that can help people at home, more nurse practitioners and pharmacists and physician's assistants, other kinds of healthcare professionals that can help take the burden off of the family doctor. So we have a team of people,
Right.
and we use their skills appropriately to ensure that people have the right care they need. And I think that's the working smarter part of it we need.
Yeah, that's the healthier system. It is very important.
Exactly.
I think a few days before we had a news from the government. It says the pharmacist, they also can have the prescription for 13 or 15. Some of the problems they can see. Also, the patients, they don't need to see the family doctor. They walk
Exactly.
walk in the pharmacist, and then you can see all those kind of services, which is good.
Yeah,
I love
it is
that.
good. It is good. I do too, because pharmacists are well trained.
Yeah.
They go through extensive medical training too. And they know, especially a pharmacist, if you go to your pharmacist, like I go to the same pharmacist, they know me. And, they know my doctor. And for something as simple, if I come in and I have a problem with my eye again, and I've had it before, and they know that, they can give me the prescription. I don't need to be taking a family doctor's time when that time could be used for somebody's child who has something that's not diagnosed. So that's part of it as well.
Yeah, that's the part you said about the health card as not credit card. So one
Exactly.
health card can go anywhere. People know you. So we talk
Precisely.
we talk about the health system, and also let's talk about the government funding. How
Yes.
the federal government funding plan to help Ontario healthcare system.
Yeah. Well, as I said, across the country, the funding that was announced was $198.6 billion over 10 years. That's an historic amount of money. And for Ontario in particular, it's going to be $73.97 billion, $74 billion in round numbers. And of that, there's just over $8 billion, which we're going to be targeting these things we've been talking about. So we're going to have agreements with the province that says, we'll give you the extra money, but we want you to do things differently. And we're not dictating what it is. We're just saying we have shared priorities. We need to have accountability, and the province is accountable not to the federal government so much. It's accountable to the people of Ontario.
Yeah.
They're accountable to taxpayers in Ontario. But what we're saying is we will give you this additional money if you use it to make sure we have more family doctors, to make sure there's more mental health care available.
Yeah.
To make sure that wait times are lessened,
Yes.
and to make sure that we have good data, that there's data that can be shared, so we actually can see whether what we're doing is working or not.
Right.
Because if we don't have the information, we can't say, does this work? So it's like I say, it's a smarter approach to healthcare delivery.
So the connection is most important, huh?
Yes.
So, yeah, we got another audience give me a question. They want to know, in the 2019 and the 2021 federal elections, the Liberals promised the voters that they will increase access to family health team. So how the funding works?
Yeah, again, this is through the funding we've already given to the provinces, and we did give a lot of funding during COVID for this as well.
Yeah.
But the problem with that is that we can give them money for it, but it's up to the province to decide how they want to use that money.
Right.
So that's why this time, for the first time, we're giving the money, this extra over $8 billion, but we're saying, we have an agreement, we're negotiating with the province and saying, we're giving you the extra money, but this time there's an outcome, there's a string. It needs to be used for this. And so that's going to be to increase the number of family doctors, especially in areas where there aren't enough of them, which quite frankly is almost everywhere right now.
Right.
So yeah, we're working on it, and it has to be a joint effort, right?
Yeah.
A joint effort with not just the federal government and the provincial government, but with all of the healthcare providers.
Yeah. Other levels, different levels.
Yeah. The family health teams, the hospitals, And even those are now working together to make sure that we are delivering healthcare in a better way.
Yeah. You know what, Leah? When you talk about everybody working together, in my image, I already picturing the whole family working together. You work here, and then the government work here, the providers, everyone. So right now, let's talk about age dignity. So one way, like for me, I do have that kind of feeling. When I'm getting old, some of the health thing, I feel shame to talk. So how do I get the dignity of the healthcare?
Yes, and I think it's very important for our elders, as people are aging, that we ensure that they get respect, that they have the health care they need, and especially for elder people who want to age at home.
Yeah.
We have to make sure that they can get care at home, because often the barriers are being able to get out to the doctor, or having the appropriate care. So I think, Pamela Care, our Minister of Seniors, I met with her recently. We were actually at Montchon, and talking there about some of the programs. And there's a pilot program on aging at home where there's more money going in to ensure that seniors will be able to get at-home care. And part of that is increasing the salaries for our personal support workers. Because a lot of times it's the personal support workers that go out to our older Canadians' homes, to our seniors' homes, to help. And they have been underpaid and undervalued. So actually in this last announcement that was made on February 7th, we committed $1.7 billion to give to the provinces to help them and make sure that these personal support care workers could get paid $25 an hour, which is a decent living wage. Right now they make much less than that. And we feel that if the personal support workers have jobs where they can make a living, where they don't have to take 2 or 3 jobs, where they can stick with the job, because it's a hard job and they deserve to be paid. I was just at the with the Prime Minister and the Member of Parliament from Richmond Hill, Majid Jahari, visiting SEIU, the union that represents a lot of the personal support workers, and talking to them. And they're so committed to our seniors and those that need help at home, people with disabilities. But they have a very hard time and they're not paid enough. So this is a big part of that, is supporting those workers so they can support our seniors and allow them to stay at home.
Very good. That's lots of things that connect together to make our healthy society. It is important.
Yes.
Yeah, let's talk about the health in society. There's a kids, because of the pandemic, some of the kids, they have to visual learning, and then they cannot go out, especially in the winter time, and then they have a little bit mental thing. So as the news, we will know the mental provider or the psychiatrist is a kind of shortage at school, even though in the society. So how can we solve this kind of problem for the kids?
Yeah, I think there's a wide range of, when we talk about mental health, it's like health, there's a wide range of illness or conditions. It's like coming in with a common cold all the way to having a pneumonia. And with mental health as well, there are people who are suffering from anxiety or, having problems in social situations because they've not been out for a long time or interacting. So there are issues in mental health challenges that, again, like we were talking about with the healthcare team, can be helped by peer groups, by social workers, by teachers. And then there's serious mental illness that needs medication, that needs, sometimes they need hospitalization. And I was just at South Lake Hospital, the South Lake Regional Health Center in Newmarket, which serves a lot of our area in my riding too. And they just have a whole new ward, inpatient ward for mental health. It's really amazing to see what they have now to help people who really need that kind of help. But like I said, there's a whole range. And there's the Pocketwell app, which has been developed for kids. There's organizations like CMHA in York region, and the bus they have, Mobus, that goes out. And our government is trying to support and fund all of these community organizations because they all play an important part in helping young people that are having challenges. So it's not only the psychiatrists, but we need them. It's also the nurse practitioners, it's the teachers, the social workers, the community organizations. And like you said, it's about having them active and out in the community.
Yeah.
So a lot of the funding we give to community organizations to help them run programs so that these kids are more active. All of that community, we talk about social determinants of health. And I think for young people, like you said, being outside, interacting, having that in-person connection, and then having peers and other people who they can talk to and just say, I'm having a tough day, And I would also say there's the 24/7 Kids Helpline that they can call, and there's the Pocketwell app on your phone. So there are other things that we've developed that are there that can provide that help, but it's again a holistic approach.
Right.
It's not one thing. It's many things.
The whole thing combined together. As I
Yes.
know, in my area, we have the parents organization to help kids. In a
Yes.
certain time, they go out for activities. In certain time, they're sitting together to talk. Just like our Xinflix TV station, we have kids came in every Tuesday and Wednesday. Leah, welcome you to join us to see the kids. They dancing and then they talking. They be on the stage. Very healthy kids. I think
Yes.
the other community, they also can copy this and then to make our community kids healthy and happier living. It
Yes,
is important.
absolutely.
Yeah.
Absolutely. But we recognize how important that is. And, a lot of these negotiations with the provinces will be around the delivery of mental health
Yeah.
through all the different, community groups, local health teams, hospitals, and even there's a new mental health hub being developed by CMHA. And, which is going to be not in a hospital, but in the community, a place where people can come and get those resources, and it's just dedicated for mental health.
Yeah.
And I think that kind of thing is really important as well.
We can help each other, huh?
Exactly,
Very
exactly.
important. Yeah.
Which we've been doing, right? All during COVID, we've been helping each other.
Yes.
We have to continue to do that.
Yeah, just like you give us a smile and then the day is started. The
Yeah,
sunshine
exactly.
is coming, yes.
Yeah,
So,
exactly.
Yeah, Leah, anything particularly you would like to tell our audience?
I think just to know that, even though the federal government doesn't deliver healthcare to Canadians, we know it's a priority. And we are very proud, I'm very proud as a member of Parliament of our national healthcare system. And we believe that it's very important that this system continues, that we have publicly funded healthcare, quality healthcare that's available to all Canadians. And that we will always, as a government, as a Liberal Party, always fight to be sure that we continue to make sure that healthcare is accessible to everybody, because that's such an important part of our Canadian value, of our fabric. And we have to change as mental health care challenges, we see those happening, as we see needs for elders changing, as we see needs within the LGBTQ2+ community changing. We have to adapt and make sure that we have healthcare services that are addressing the needs of all Canadians. So it's a constant evolution, but we have to continue to innovate and get smarter about how we deliver healthcare, because it's not just money. It's ingenuity, it's technology, and it's supporting the workers who are working in this field. It's a people business, right? Healthcare is a people business, and it's about the mental health of our healthcare workers. So I want to make sure I give a shout out to everyone who works in the healthcare system, anyone who's listening, who's a doctor, a nurse, somebody who works cleaning the rooms in the hospitals, a personal support worker, a mental health worker, a community worker, all of these people, and I would say even teachers are an important part of making sure that we have a healthy population and we have a country that is functioning as best we can. And I think it's a smart investment. It's not just the right thing to do, but if we're healthy, if we're not missing work as much, if we're feeling well and energetic, we can do so much more.
Right.
And that's what we want for our country. We want a healthy, vibrant country. And I think we have a good basis, and we have to keep working to make sure that that kind of healthcare and that kind of life is available to everyone in Canada.
We're still on the way. It takes time. Yeah.
It does.
It takes time. So also people have to be patient and then to be support to each other. So and then this is a combination of our society. So we want the big family become healthy, and also the individuals have to be healthy too. From the little kids until the elders, and then we also want the quality, also want the quantity. So the both way.
Yeah.
It is.
No, I agree. And I think you're right about the families. Families can do so much together.
Right.
I mean, just, even going for a walk in the woods, right? I think in Japan, there's something called nature bathing or tree bathing, right? Like being outdoors, being around trees and talking to one another, or taking your pet for a walk if you have a pet, just getting out and really making sure that we're doing what we can for ourselves and our children, our elders, our partners, and our community to all take care of each other.
Right. In Chinese, what we say is smiling. When you smile, from the in and out, you feel the sunshine is with you. So that is have a better life or better day from the very beginning. So that's
very wise. I agree.
Yeah.
Smiles are important, right? They say laughter is the best medicine, and I think smiles, it's like sunshine.
Yeah, and also what, Leah? Today when I see your color, your suit color, it makes me like the sunshine is here. So it is good. There's a lot of way to change your mood. Yeah, because when you are happier and then you're healthier, that's what we believe too.
Absolutely. So let's all hope for a happy, healthy 2023.
Yes, all the best.
Keep working together. Working together on our healthcare.
Leah, it's very good to talk with you, and also I think the audience are very happy. Actually, I have a few audience here with me. They're very happy. They hear your voice, and then they say they love your voice. Thank you so much for coming with us.
Thank you. Thank you for the opportunity to talk to you about this.
Thanks for your time. You have a good day.
Take care. You too.
Take care.
Bye-bye now.
Bye-bye.